Hello, this is Health Matters, a production by the Ministry of Health. I'm Nazim Hussain. On today's program, we'll be talking about the Beacon Foundation Limited, established in 1985. They're observing their 40th year this year, and with the theme honoring the journey, 40 years of hope, comfort, and care. To tell all, we've got a numbers of their members of their board of directors, and we'll start off with Mr. Vikram Oditt. Tell us, sir, welcome to Health Matters. 1985, how did it all start?
Thank you, Nazim, and first of all, let me express our appreciation to the staff and the ministry for hosting us on this important occasion of our 40th anniversary. Mm-hmm. We do appreciate that. Well, in 1985, 5 people got together. Mr. Clay Matlai, who became our president, Mrs. Doreen Carries, Mr. Albert Rodriguez, an architect, Dr. Bud Mangal, and myself. We were the original 5 directors of Beacon. Mm-hmm. Of the 5, Mr. Lai retired, and Mr. Rodriguez retired from the directors. Dr. Mangal unfortunately passed away, and Mrs. DeCaries and I are still on the board of directors. Mm-hmm. And of course, it has expanded considerably as the work of Beacon has expanded, and we're in a good place now.
Back in 1985, what triggered for this group to come together to start up this organization?
Things were rough in Guyana,
mm-hmm.
rough in Guyana at that time. And we saw the need for organizations to come along that can help both medically and socially. And so we got together. We were disappointed at first because of the situation in the country where the money supply was tight. Funds for organizations like ourselves were difficult to come by. So we realized we relied on friends to start with. Mr. David DeCaries registered us free of cost. Other people chipped in. We got the Kisun group of companies to sell us at a very discounted price our original location at the corner of Carmichael and Cromwell Streets. And we got another family donated some land on the West Dam for us to sell to get seed money to start operations. But we recognized that we couldn't do much by just begging and asking people. So we put our brains together, Mr. Lai, and with some small help from myself, and we started snackettes to run businesses to generate profits to finance our activities. That was the principle behind it all that started Beacon and led Beacon to many successful ventures.
And just to let you know that the Beacon Foundation is providing care for terminally ill cancer patients and their families. For the first 2 decades, how was it?
Well, we had 2 excellent nurses working with us. Nurse Cecilia Benny, who, although she's no longer with us, she's still in the field of cancer with the Cancer Institute, and Nurse Angela Pyle. And those were 2 very dedicated nurses supported by our matron, Nurse Ramsen. And we did our best with the funds that we had mm-hmm. to provide palliative care in a domiciliary way in the homes of the patients. So that went a far way to start the program going.
Mm-hmm. Was there any time with the challenges then in the 80s you thought that it will fall apart?
No. That was never in our thought. Mm-hmm. As I said, we were very positive. We were generating funds from our snackette, Water Street, the one by the Central Garage Car Park. And then we started a larger restaurant snackette at our Carmichael Street location. So once we were generating funds to support our programs, we knew we were on the right track. And tremendous thanks to our then president, Mr. Claymont Lai, who was the driving force behind it all. He dedicated his life completely to Beacon, and he drove Beacon in all his projects, almost single-handedly with support from the board, and we owe him a big, big debt of gratitude, Mr. Lai.
Mr. Oditt, thanks a lot for being on our program, and we wish you all the best.
Guyana is taking a bold step towards a healthier future. Introducing the Universal Health Voucher valued at $10,000 available to every citizen. This initiative by the government of Guyana gives you the opportunity to access early screening tests for non-communicable diseases like diabetes, hypertension, and cardiovascular conditions, with NCDs accounting for approximately 68% of all deaths in Guyana. Early detection is important. This program represents a $5 billion investment in the health and well-being of our nation, benefiting 500 people across the country. Eligible individuals include children from birth and adults 18 years and above. At the back of the voucher, you'll find a comprehensive list of tests available to you. To locate facilities where you can access these services, simply scan the QR code provided. This will direct you to a list of accredited healthcare providers. Don't hesitate. Visit your nearest health center to uplift your voucher and take charge of your health today.
So from a historical perspective, we've got an idea about the Beacon Foundations and what the work they do from then. But what's happening now? And I've got with us today Mr. Patrick DeGroot. He's chairman of the board. What's happening with the Beacon Foundation in the recent 10 years?
Well, let me go back a little bit further than 10 years. We changed in 2013. We were forced to sell out our building and close the snacket. We used to have a big contract with Cerro Pato School of Education for 100 meals a day, breakfast, lunch, and dinner. And that was a big source of income and was very profitable. But they took the contract away from us, and we ended up closing the building, closing the snacket, and we sold the building 2 years later. And we got a building to buy at the corner of Peter Rose and Thomas Street. And we set up an office for the nurses, and we had an extra 2 rooms where we set up a hostel for patients who live out of town and have to do chemo or radiation at public hospital. They can't afford to go home every day and come back. So they stay free of cost at Beacon, and we provide them with breakfast, lunch, and dinner. And they can go over to the hospital very easily because we're very close to the hospital. We don't have any source of income other than we rent the downstairs to our pharmacy. So our money, all the money we had was what was left over from the sale of the 1 building and buying the new building.
Other than the Ministry of Health, are there any other partnerships that the foundation would have developed over the recent time?
No. We are now hoping to start that now. Going forward, we'll try to get funding agencies or the oil businesses to come on board with us. We just have to convince them that what the work we do is worthwhile.
In these recent times, why is it important for there to be this kind of support and this kind of service available to patients who are terminally ill as a result of cancer?
One of the, especially in the outlying areas, people think that cancer is contagious like AIDS. So when a family member gets cancer, they tend to put them out the house. And Beacon has to go and look for them when they refer to us and counsel the family members and the patient to get them to move back in. because the care we give is in-house care. We don't have any facility for the patient to live at. So the patient has to be at home. So that's where Nurse Bibi comes in. She will explain to you how important that is.
Right. Over the past couple of years, 10 years and so forth, what was it like? You were seeing a decrease in taking care of the terminally ill, or you were seeing an increase?
A big increase. Because our finances were limited, we don't advertise what we do. But it's just word of mouth. And the word is getting out that of the service we supply, we think, and we're getting a lot more patients now. In fact, on average now, we have 120 patients a month.
Other than the resource issues, finance and so forth, what are some of the challenges?
The big challenge is with our nurse. We only have 4 nurses. We presently only have 3, but we're going to employ another one. But in the outlying areas, the staff at the health centers and so don't have much training in hospice care. So that is the big challenge. And going forward, we need to work with the ministry in training the staff in the outlying areas to work with these patients.
We would like to thank Mr. Patrick DeGroot, Chairman of the Board of the Beacons Foundation, for being on our program today. Joining us now, we've got Mr. Ramesh Seebarran. He's also the Secretary and Board Member of the Beacons Foundation. Tell us, we've heard about the challenges, we've heard about resources much needed. What is happening on the ground?
Well, thanks very much, Nazim. So the challenge is both Vikram and Patrick alluded to, relates to our ability to finance the things we would like to do. Based on the number of patients we're seeing on a monthly basis, the required finance that we need is starting to exceed.
And how much are we talking about here, 2025?
We need at a minimum.
No, how many patients
we have
in the fields?
We have
And
about 120
what is the geographic
plus.
area we're covering?
It's regions 4, 5, 6, regions 10, and sometimes region 2. We don't visit region 2, but we have referrals. And I recall we did a visit some time ago, but I'm sure Nurse Bibi will allude to that later.
What has been done over the years to ensure that you still provide those visits every time?
So to go back a little bit, we had a vehicle which is now retired, and we were lucky to have Bihari Group of Companies donate a brand new vehicle to us. So that has helped immensely to facilitate us visiting all these regions on a weekly basis. Each month, we're can safely say we have visited all the patients. In the event that we haven't visited a patient, we would connect with the patient through telephone to make sure that they're doing fairly well. Finance has always been an issue. It's no secret. We've been receiving donations from some persons who have been regular. The St. Christopher organization in the UK donates to us annually around £5,000, and that has helped significantly to provide some care package, some goodies for the patients. And we have received, our other source of income would be from the part of the building we are in that we're renting to a pharmacy. And occasionally we will receive donations from other parties. But above all of that, the Ministry of Health has played a significant role in supporting our financial needs by paying the salaries of the RNs.
Do you think you need more additional staff, more additional human resources to really bring a more wholesome delivery to your services.
Definitely, because Patrick mentioned that there's always need for more patients to come on board. We haven't advertised simply because we don't have the resources. But if we can get more resources, definitely we can have more patients on board. I just want to add, though, that Beacon Foundation Financial Affairs is up to date. The accounts, financial statements have been audited by Ram McRae for the last 39 years, just one 2024 accounts still to be audited, but that will be done very soon. So yeah, we really appreciate the pro bono work done by that firm as regard getting our financial affairs up to date.
That's Mr. Ramesh Seebarran there, the secretary of the Beacon Foundation. And we're talking about them observing their 40th anniversary this year. Don't go away, we'll be right back after these messages.
Have you heard? The Ministry of Health has launched its cervical cancer screening voucher program for women aged 21 to 65. Eligible women can pick up their vouchers at any distribution site in their regions. Each voucher, valued at $8,000, can be used at any of the health facilities listed on the back of the voucher. Cervical cancer caused by persistent HPV infection is the second leading cause of cancer-related deaths among women in Guyana. Early screening is crucial to detect and treat precancerous cells. Early detection saves lives. Ladies, don't hesitate to get screened for cervical cancer today. Your health matters. For more information about this program, call 227-4357 or visit the Ministry of Health's Facebook page.
Welcome back to our program. We've got another board member, Dr. Shanti Singh, working on the technical side with the foundation, and we're going to find out about her role with the Beacon Foundations. Dr. Singh, welcome. Tell us a bit about your role with the foundation.
Thank you, Nazim. So before I get to my role, I want to share a little bit about my introduction to Beacon Foundation. And so you would know that many years ago, I was the head of the National TB program, and then I worked with HIV, heading the HIV clinic, the now National Care and Treatment Center. And I recall in those days, patients had to take quite a lot of medicines. And so my formal introduction to Beacon Foundation was when we were able to send a lot of our patients with TB and some of our HIV patients to the soup kitchen that was alluded to earlier. And so they were able to take their medicines on a full stomach. And so when I was called about 3 months ago to join the foundation, I was more than happy to join the foundation because I understood the impact of the work on people's lives, especially those who need it. So some of our most vulnerable in the community. As a member of the board of directors, there are 2 medical doctors on the board. And so it's myself and it's Dr. Sheena Chin. Now, she is an oncologist. She's attached to Georgetown Public Hospital in the oncology department. And so she has more hands-on approach in terms of how we manage patients with nurse Bibi, who you will hear from as well. But we also are able to provide guidance to service delivery so that our patients can get the best possible palliative care. Now, we've heard earlier that there's a need to scale up what we're doing. And that is true because we know that the ministry has been putting out statistics that there's an increase in the incidence of all different kinds of cancer, whether it's breast cancer, cervical cancer, prostate cancer, there's an increase. And so with that increase, there is the need for greater number of people to be on palliative and hospice care. And so while currently, even though we are challenged in a number of ways, we do provide the best service that we could in terms of palliative care. The team that we have working with the foundation are very skilled in what they do. And so with these increasing numbers, I think looking forward, we want to be able to provide that service to greater number of people who would need it. I think going back to what I said earlier, Beacon Foundation has always been about providing services to those people most at need, those who are most vulnerable in the society. I think that the service that was described in terms of having a facility that's very close to Georgetown Hospital so that people who need either radiation therapy or chemotherapy and are coming from out of Georgetown and need a place to stay, some meals, 3 meals per day, is a really big achievement for the organization. I think that's one of the things that we should celebrate, that we're able to provide this service to people who can then come to the hospital and access their services. But I think that there is also a greater need for people to understand that the work that Beacon Foundation is doing and the support that Beacon Foundation can give the people. So for the general public, for people who have relatives with cancer, for cancer patients themselves, Beacon Foundation is a resource for those people. So feel free, you can contact us. I think the numbers will be posted on the screen, but you can contact us, you can reach out to us. We'll be more than happy to provide the support that we can, so that what really matters is not the number of days that you have left for somebody who is a cancer patient, but it's how you live those days. And what we provide at Beacon Foundation is a quality of life and support to those people.
We heard from the other directors that there is a relationship between the foundation and the Ministry of Health, but coming from you that there is also a good relationship with the GPHC, Georgetown Public Hospital, and so patients might be comforted, and those who would want to join the foundation will know that there is this good relationship. And what about maybe those patients who may are at private facilities but still would need that care because that end is there? Can persons who are not from the GBHC but at private facilities, can they also come on board?
Absolutely. It's open to anyone. Mm-hmm. And so again, Bibi will tell you more about palliative care and the services that we provide, but it's open to anyone, whether it's public or private. I think because we're located very close to Georgetown Hospital, because a lot of cancer patients would get their chemotherapy at Georgetown Hospital or at a cancer institute that's within the compound. The fact that the facility that we have at the office is very close to the hospital makes it really convenient for patients and their families.
Mm-hmm. We've got nurse Bibi Salim, who is one of the workers, one of those nurses who are having the hands-on with the patients in the fields. And we've heard sometimes in region 2, and of course the other regions in 4, 5, and 6. Nurse Bibi, welcome to the program. Tell us, when you go out in the field, what happens?
Okay, thank you very much for having the Beacon Foundation to emphasize or to publicize what we do at the foundation and to celebrate our 40th anniversary. Now, as I am considered the lead palliative care nurse at the Beacon Foundation, I was trained in palliative care at the St. Christopher's Hospice in London. Now, our staff is very small, but we offer all services. We counsel our patient, we offer medication, we hold their hands, we cry with them, we do everything. Because palliative care is actually a support system. It is the WHO definition of palliative care is services that is provided to anyone who has been diagnosed with a life-limiting or a life-changing condition. Beacon Foundation deals specifically with cancer patients, but palliative care actually should be offered to, like I said, anyone who has been diagnosed with life-limiting or life-changing condition. We are specifically for cancer patients, but we do not limit ourselves to that because there may be someone out there who needs our service. We don't call them our patients, we call them our beneficiaries because they benefit from us. We still see them, we still offer the same services, but we don't put them on our register because we deal specifically with cancer patients. Now, we see patients in region 3, 4, 5, and 6 physically, which means we visit them once per month, every month, as long as they're available. We call ahead and let them know we're going to be visiting your area if you're available. We do not force ourselves on anyone, and we do not try to change your perspective of how you live or what you eat or whatever modality of treatment they may want, because there are some people who would prefer to go the conventional treatment like chemotherapy, radiotherapy, but the herbal treatment. we don't say, look, because you're going that way, we're not going to see you. We see them regardless. We see each and every one of our patients as a human being, regardless of your religious background, regardless of your financial situation, regardless of where you live. If you live in a dog pen, we will come and sit with you. That is what we do at the Beacon Foundation. We offer medication. Thankful to the Ministry of Health, they provide us with 99% of all of our medication that we take to our patients.
You must have got some feedback, especially feedback from the family. What are some of those feedbacks that you would normally get?
Okay, the feedbacks are like every person in life. There are always differences on how people see you, but most of them are absolutely positive. If we are supposed to be visiting an area, like when last month, unfortunately, our previous driver died, so we were unable to visit one area. Those people called the office wanting to know why we're not coming, when we're coming. It means they really appreciate what we do. The families will do it. The patients themselves will do it. They want to know where you are, why you're not coming, why, even if they don't need medication. They just need to know there's someone in their corner, someone who will sit, listen to their stories, be empathetic with them, and work them through the process of living your best life after this diagnosis.
We've heard that there's, some of the families will stigmatize and, want to shun some of the patients.
Yes.
What do you tell those family members?
All right. The first thing we do when we go in, we hug them, the patients, not the family members. So if I'm a stranger and I'm hugging you, you have cancer. That tells the family something already. Oh, it's not catching because she's a stranger and she's hugging my family member. So that alone will tell them nothing can happen to you because this person has cancer. We consider ourselves the huggers. We hug everybody that we go into their homes, every single person. We do not, like I said, we do not discriminate. If you have on rags, it's okay for us. We don't see your clothes, your financials. We see you as a human being.
Thank you very much for being on our program, Miss Bibi, Nurse Bibi.
The HPV vaccination campaign is back. The Ministry of Health has restarted its HPV vaccination campaign, which targets anyone ages 9 to 45. The HPV vaccine is safe and highly effective in preventing cervical cancer in women, as well as penile and anal, mouth and throat cancers in men. This vaccine is available free of cost at all health centers across the country. For children to be vaccinated, we will require you, the parents or guardians, to sign a consent form. The vaccination process is quick and easy, so why wait? Visit us and get vaccinated today. Protect today for a healthier tomorrow.
So as we put a wrap on our program for this week, Mr. Vickram Oditt, board member, to wrap up for us. It's been 40 years. Lots of thank yous.
Yes. Time does not permit us to say all the thank yous, but it's been a tremendous journey. People have helped us along the way, Guyanese, overseas people, governments like the Canadian government, USAID. Many helpers along the way. It has been a fantastic journey, both for Georgetown and in the interior areas, among the Amerindian villages, among the several areas of the interior and so on that we functioned. And I must say that we're not going to rest on our laurels, that we see this as if only the first 40 years of Beacon's existence. We've got a number of young directors, Ms. Matai, Dr. Chin, who have joined us, and we see that we will be able to hand over to a group of dedicated directors who will ensure that Beacon continues, not only for the next 40 years, but beyond.
Thank you for being on our program, Mr. Vickram Oditt, and I'm quite sure the number of patients that you are seeing, your organization is seeing, would like to say thank you for the great job that the Beacon Foundation has been doing. The Beacon Foundation providing a lifeline to those persons who are terminally ill as a result of cancer. This is Nazim Hussain. Thank you for being a part of our program, and do join us again next time. Until that time, be well.